Incisional hernia locations. Midline incisional hernia. This type occurs along the center of your abdomen, following a vertical cut from previous surgeries. The hernia develops around this midline area, phalansteal incisional hernia, located in the lower part of your abdomen. This hernia is associated with a specific type of lower abdominal cut, known as a phalansteal incision, paramedian incisional hernia, close to the center but not exactly in the middle. This hernia develops in the paramedian region of your abdomen. Transverse incisional hernia, formed after a horizontal cut across your abdomen. This hernia is situated along the transverse line. Epigastric incisional hernia, positioned in the upper part of your abdomen, above your belly button. This hernia occurs in the epigastric region. Umbilical incisional hernia, around or near your belly button, umbilicus. This hernia is related to surgeries involving the umbilical area. Lateral incisional hernia, found on the sides of your abdomen, away from the center. This hernia develops in lateral regions. For more details, connect with Dr. Tulips Tots at 988 613 9999.